The Inspector General's report cited multiple cases of children who experienced trauma, such as murder, kidnapping, or rape prior to arriving in the U.S. Mental health clinicians at the Office of Refugee Resettlement run facilities reported that they were concerned over challenges like larger caseloads and transfers that negatively impacted children. For example, in one case, a child was moved from a facility in Florida to a facility in Texas to be reunited with her father. After the child made several trips to the detention center, she was returned to the Florida facility, quote, in shambles, without ever seeing her father.
They expressed their concerns about being able to treat children who had encountered intense trauma before coming into care. Now, this is a concern they had in terms of treating all children. They noted it was additionally challenging treating younger children who had different needs and different therapeutic needs and had less attention span.
The report said children with severe mental health needs like oppositional defiant disorder or suicidal ideation, quote, remained in settings not well equipped to address their needs, end quote. It also said some children who initially didn't show signs of mental health or behavioral issues developed them as their stays grew longer. The report also describes shortages in mental health providers, especially those who are bilingual. That reflects a national shortage, especially in rural areas. Right now, it would take more than 1,800 mental health providers to cover the gap of mental health professionals in rural U.S. counties. And a report from the American Association of Medical Colleges shows by 2032, the U.S. as a whole could see a shortage of at least 3,400 psychiatrists. So what are some of the mental health impacts on the children in these cases? At their age, the brain is still developing, and the stress can cause cognitive and behavioral function to stay in what experts call survival mode instead of growing skills like logic. The National Child Traumatic Stress Network says some of the long-term impacts may include self-harm, unsafe sex, and high-risk behaviors like alcohol and substance abuse.